to talk a little bit about some of the violence that we saw yesterday in the city of Richmond. First, let me say that the violence that occurred in our city yesterday was not only a tragedy, but also is unacceptable. I really don't care that all of our violent crime statistics are down for the year. And I know the families of these young victims don't care either. A young life has been lost. And 2 innocent children, one 3 years old, another 6 years old, who were doing what 3 and 6 years old kids do, are now gunshot victims. You know, the hardest thing about this job at times can be getting the call, getting the text message from those over at RPD about another life that's lost in the city. And what is the hardest part of that is when we know it is a child, a teenager. As the chief said earlier today, if this doesn't bother you, it's time to get your heart checked. Anytime we lose a life in a city, it hurts. But it hurts even more when it's a young person. We all know it needs to stop. We all want it to stop. And it's going to take everyone working together alongside those at the Richmond Police Department to ensure it stops. This is a community project just like everything else we do. We have to do it together. We know this is an unprecedented time. There's been a lot of movement to change the way we do things in this country, do things in the city, and we all know that a lot of that change is long overdue. But it's also time for us to come together as a community, the community that we always have been, one Richmond, residents, organizers, administration, council, faith leaders, the police, to take a stand against something we can agree on, and that is stopping the violence in our city. So I urge anyone with information about any of these crimes to call Crime Stoppers at 780-1000 and work with the police department to help bring those responsible to justice. Let's make sure our priorities are where they rightfully belong, and that's public health and public safety of our children. Now, I'd like to talk about public health and that of COVID-19 in the city of Richmond. As Governor Northam made clear yesterday, and the news from other states across the nation made clear, the coronavirus isn't going anywhere. It's here, it's in our region, it's in our state, it's in our country. It's not going anywhere. Statistics presented at his news conference yesterday show that while most regions of the Commonwealth maintain steady and relatively low rates of positivity, between roughly 6 and 7%, others, such as Hampton Roads, are seeing a more dramatic spike. As you saw, this prompted the governor to call for more diligence and enforcement of mandatory mask wearing in closed spaces. And I want you all to know today that I wholeheartedly support the governor on this effort. Now, 2 weeks into phase 3, Central Virginia's status relative to the virus has plateaued. And after seeing steady declines through the month of June, the city of Richmond has seen increases in its daily case count, from roughly 15 to roughly 25 a day. Fortunately now, our percent positivity rate has remained low at 6% and well below our target of 10%. That's literally positive. Currently, we have had 2,473 cases in the city of Richmond. When you look at the city of Richmond's workforce, here at the city government, 19 city employees have contracted COVID-19, and that figure includes 2 city employees who have unfortunately perished because of this disease. As of today, we've lost 36 residents to this deadly virus, and I'd ask those here and those watching at home, just take a moment of silence to remember those we've lost. Thank you. So we continue to make every effort to mitigate the impact of the pandemic. The way it's impacting those for our residents, whether it's health, their welfare, whether our residents are business owners or they're just those who choose to visit the city. By now, you all are well aware of our programs to assist small businesses and restaurants, as well as the funding we have secured to support efforts to provide PPE to high-risk populations in the city, provide financial assistance to families in need, and to provide emergency housing assistance to those who can't afford to isolate or run the risk of losing their home. Today, I'm going to just highlight one program that we introduced this week to provide rent relief and housing assistance to serve our immigrant community heavily impacted by COVID-19. Thanks to a $250,000 grant from the Open Society Foundation, we will be able to offer assistance to those households that fall between the cracks because they are non-citizens or mixed immigrant status. This program demonstrates that everyone, regardless of immigration status, deserves a place to feel safe and secure. We also continue to work with our partners at the Richmond City Health District to provide free testing and to encourage those who need help to call the RCHD hotline. That number is 804-205-3501, or to continue to visit RVA Strong at rvastrong.org. And online, that's our online resource for those who need a hand, need a help, and those who are willing to provide a little help as well. Earlier this week, RCHD hosted a testing event. I think it was yesterday, right? Hosting a testing event yesterday in the city. There is another event tomorrow in Henrico at Tuckahoe Middle School on 3 Chop Road, and more events will be forthcoming. I also want to remind folks that there are nonprofits in the community that are also offering free testing as well, whether it's Daily Planet or Health Brigade. Those are options for our residents too. Now, we're very fortunate today to have Dr. Danny Avula once again to offer us an update on COVID-19, its impacts in the city of Richmond. So I'm going to ask Dr. Avula to come and provide a couple comments. Dr. Avula.
All right, thank you, Mayor Stoney. Good afternoon, everybody. I just wanted to give a little bit of context for some of what we're seeing here in the city in terms of case counts. As the mayor mentioned, after really impressive, significant declines through the month of June, we went into a plateau and have actually seen a slight increase in our number of cases per day here in the city of Richmond. Again, from about an average of 15 new cases a day to about 25 new cases a day. So that's something to pay attention to. It is, to some degree worrisome, right? We obviously would like to be back where we were at the end of June, but it also corresponds very closely to our Phase 3 reopening. Remember that we went into Phase 3 on July 1st, and typically as people become more comfortable being out in restaurants and out in businesses, and giving an opportunity for the virus to transmit from person to person, we would expect after an incubation of about 7 to 9 days that we would see a bump in disease. So, what we're seeing over the last few days certainly corresponds with phase 3 reopening. Now, the hope is that this is a temporary bump in case counts and that we see that start to trend back downwards again. Some of the modeling that has been done by our partners at the University of Virginia do show that the potential is there for us to reach another peak that really goes on an upward trajectory and peaks in late August or early September. And now remember that a model is not a prediction of what will happen, but rather an estimate of what could happen if we are not taking appropriate measures. And so, as we always say every time we're up here, we need to continue to do the things that make a difference. Monitor ourselves for symptoms and exclude ourselves from congregate activity. We need to wear our masks and maintain distance and wash our hands regularly. And so that continues to be as true as it always has been. You heard yesterday the governor talk about his reiteration of the mask mandate and the role that health departments and others will be playing in enforcement. So what will come is there will be about 100 new staff that will be hired across local health departments throughout the state that will focus, in addition to the staff that we already have that do restaurant inspections and permitting, and so there will be a more proactive role than we've played historically in looking at to enforce mask wearing. We, to this point, have really just, when we receive complaints, we will follow up with the restaurants, we'll reiterate the guidelines, we will encourage restaurants to adhere. When we have restaurants or other businesses that have multiple complaints, we do take a next step, making it clear that we have the ability to pull a permit. Thankfully, we have not had to do that to this point. Our business community has been really responsive. But we do continue to receive complaints on almost a daily basis. And so, I think now as we are in an upward trend of disease, it will be incumbent on us to take that next step of enforcement. I want to talk a little bit about death reporting. I've received some questions about what has been happening in terms of deaths in the city. We've gone from about 28 or 29 deaths about a week and a half ago to now 36 deaths. But I just want to be really clear that those are not new deaths. One of the procedures that the state has engaged in is looking at death certificates that have COVID listed as a potential cause of death, but not as the primary cause of death. And so as the state goes back and reviews those death certificates, they're adding numbers where COVID is listed as a potential cause of death. So that increase in deaths in Richmond does not actually indicate new deaths. Our last death here in the city still is back on June 19th. But I just wanted to take a second to explain what you might be seeing on the websites there. And then the kind of the last point I'll make is really around testing turnaround time. I think the reality of this outbreak spreading across our country has shown us again the limited or the lack of progress we've made nationally in testing capacity. So while the availability of testing is still good, you can go to your private provider, you can come to our health department testing events, you can go to CVS or other urgent care centers. The turnaround time, we've seen a big uptick. I really think it's due to just the overwhelming demand that we've seen throughout the south and southwest parts of this country. And so we're seeing more like a 7 to 9 day turnaround, and that's really problematic for us when we're trying to manage outbreaks. So just wanted to give a status update on that. Thankfully, again, access to testing is good, and hopefully our institutions locally, the state lab continues to be a 2 to 4 day turnaround. Our health system partners have had good turnarounds, but it's an issue to keep our eyes on and ensure that we can continue to manage the spread of disease. Oh. Testing dates, sure. So we do have 3 upcoming testing events next week. Tuesday morning, we will be at Hotchkiss up in the north side of the city. On Thursday afternoon, we will be in Randolph in the south side of the city. And then on Saturday, we will be at Fairfield Middle School in Henrico County. But plenty of options. Again, call that hotline 205-3501. Get pre-registered. Oh, sorry, yes. The hotline 205-3501. The best way to get the details on location and time and get pre-registered. That'll just help us with staffing, but you can also show up directly to those events. The postings for those events will be on our website, rchd.com, also on all of our social media platforms.
Thank you, Dr. Avula. Obviously, we know since this pandemic sort of struck in March, this has paid an impact on our families here in the city of Richmond, particularly those families that have children. Just because Richmond Public Schools has not been in session in the facilities does not mean that schools have not been, RPS has not been working. Led by my friend Jason Kamras, I know they've been doing a lot of work. Some of that work on the future of RPS and where it goes coming this fall was discussed this past evening. I'm going to have Mr. Kamras come up and speak a little bit to that and what we can expect from Richmond Public Schools. Mr. Kamras.
Thank you so much, Mayor. Before I talk about next school year, I did want to acknowledge, as the mayor did at the outset of his remarks, the loss of a 15-year-old student, RPS student, last night. Since coming to Richmond, I have now lost count of the number of students we have lost to gun violence, and certainly the number who have been affected by gun violence. As you heard, we also had a 6-year-old and a 3-year-old who were shot, and we also lost a mother of 7 RPS students last night as well. And so if you would join me in a moment of silence for all of them, I would appreciate that. Thank you. As the mayor shared, and as I imagine just about everybody in Richmond knows, the school board yesterday evening voted to adopt my recommendation for a fully virtual opening to the school year for the first semester for next year. And I want to say first a word of thanks to everyone in the community, our families, students, teachers, support staff who shared their perspectives. I personally received several hundred emails, phone calls, texts. I know school board members did as well, and many folks submitted public comment. That feedback was incredibly helpful as we worked through this very difficult decision. I also want to thank the board, who had to weigh all of these very difficult choices. This was the hardest decision in my 25 years in public education. We know by making this choice that there are families and children who are going to face enormous hardship. Families who do not have childcare cannot afford childcare for their children, and that is going to have a dramatic impact on them financially, emotionally, and in so many other ways. We know that some kids do not learn well virtually. It is particularly hard for younger children. And we know that home is not always a safe place for some young people. And so all of those factors made this a very, very difficult decision. But at the end of the day, as a superintendent and as a father, my number one job is the health and safety of our students and all of our staff. And so that led us to this decision. And my commitment to our students and our families and our staff is that we will do everything humanly possible to make our virtual school year or virtual semester as successful as it possibly can be. We will work around the clock, as we have been since March 13th, to be as creative and as innovative as is humanly possible to create a rich, exciting, engaging, and loving school experience for our children, even though they will not be in our school buildings. A few things I want to clarify. Number one, even though we will be virtual, our meal program will continue. It has been going strong since we closed on March 13th, and it will continue throughout next school year. As long as we are virtual, we will continue to distribute meals, and that is our number one commitment. Second, on academics, I want to clarify that this coming fall will be different from the spring, where we largely used pre-recorded teacher videos. This fall, we will have live teaching over the internet that will be interactive. Third grade class will have their third grade teacher. They'll have a morning meeting. It will be over Google Classroom. But we will ensure that there is live, interactive communication, learning, and so on between teachers and students and counselors and social workers and so on. In addition, on the academic front, I want to be clear, there will be graded assignments, there will be grades, there will be report cards. In that respect, as well as attendance, it will reflect the normal requirements of a school year. And then finally, on the social emotional front, we are thinking very hard about how we support our students' mental health, as well as that of our families and our staff during this virtual experience. I will tell you, as a father, when I broke the news to my eldest son, who is slated to start middle school this fall, he was heartbroken. The idea of starting middle school without being physically with friends, without physically walking his new school, really hit him hard. And he and I and my family are lucky to have enormous advantages in life, and many families in Richmond do not have those advantages. And so we are thinking very hard about how we support our young people from a social and emotional perspective, thinking about how can counselors and social workers and psychologists and others play a role in this virtual environment to make sure our students are taken care of, the entire whole child. And then finally, let me just say this to our students, very similar to what I said on March 13th, which feels like a lifetime ago. We are going to do everything humanly possible to support you next school year. And we love you very, very much. Thank you.
All right, thank you, Mr. Kamras, for those comments, and I know those decisions are certainly not, were not easy for you and the board to make. I want you to know that we appreciate you and the board for doing what's right by our children and putting public health and public safety first in this most difficult time for our city, for our state, and for our country. So with that, we will take a few questions.
Mark? Thanks for holding this, Mr. Mayor. To date, your administration hasn't given any sort of indication of the cost to the city stemming from the ongoing civil unrest since late May. What's your timeline for doing that?
Working with the police department, we hope to have something as soon as we can. Chief, do you want to speak to that? I mean, I know we have a number of evaluations we need to do. The chief, I think, has even spoken to the fact that there's some after-actions reviews of what occurred in the month of June as well. What will come with that also will be what was the cost and the spend by the Richmond Police Department.
That data has been collected now. It's already been asked for and it's been collected now.
So he said that is being asked for and being collected now. I'm sorry I did not repeat the question. I will do better next time.
Superintendent Kamras, question for you.
Yeah, just speaking to the virtual learning and also the eviction crisis that is about to hit our city as well. What types of technology access are you thinking about right now, especially for those families that may be facing eviction? And do you know if Comcast is still going to be offering free internet to help families out as well?
Well, I don't know about Comcast, but I can say this. Since the closure, we have distributed 16,000 Chromebooks to our students, 6,000 Wi-Fi hotspots. Just to give some context, we have about 25,000 total students, to give you a sense of the percentages there. We are committed to actually providing a Chromebook to every RPS student, regardless of economic need, given our decision to go virtual. Doing that will enable us to more easily push out software updates, login information, new applications, and so on. And so we will be in a position to be a completely one-to-one school division. In addition, we will provide devices and internet access to any staff member that needs that as well. Beyond the technical pieces of it, there will be a great deal of training for our staff about how to use all of these things, but also how to teach in a virtual environment. How do you keep kids engaged? How do you do a quiz? And so on. So that will all be part of our efforts.
Just to follow up to that, are there specific things in place in terms of what they can do for the virtual learning right now? Specific examples that you can speak to? I know you just mentioned, some goals, but
I didn't quite follow the question.
yeah, what are some specific training tools that students are going to be able to utilize now that are coming from teachers?
Training for how to use the computers?
No.
Sorry.
Being trained, the teachers, what type of training are they getting right now?
I see.
To be able to teach the students in this setting?
Yes. So all of our teachers in our summer program have gone through training because they're doing the work right now. And what's happening right now in our summer program is similar to what the fall will look like. So we are using that training that we did for teachers over the summer, refining it, and then we'll be rolling that out for our staff over the next couple of weeks. Based on our survey that we put out to staff, we know there are very different levels of need with our staff in terms of training for a virtual environment. A majority said they feel like they need about a half a day to a day's worth of training, but there was a significant minority that said they needed more than 2 days of training. And so we are creating a differentiated training program that will meet our teachers where they are so that they feel confident and ready to work in this virtual environment. And it's not just for our teachers. The same is true of our counselors and our social workers and office assistants and so on.
And I asked about the families that are facing eviction. I don't think you touched on that part of it. Is there any specific things in place for them?
So our Office of Engagement reaches out to our families that face housing instability, and that could be eviction or any other reason, to try to maintain contact with them, to get them whatever support they need in terms of social services, but also to get them the technology that they need, make sure they're getting food and meals and so on. We will continue to do that. the urgency of doing so has only increased with a virtual opening coming this fall. Well, look, we are going to work, RPS, with the city, with partners like the YMCA, with the philanthropic community, Parks and Recreation, to try to figure out a way to support our working families, to see if there is a one Richmond approach to childcare. And that's certainly my commitment on the RPS side, and I'm certain it's the commitment from the mayor. I'll let him say more about that. But we're going to do everything we possibly can to help those families.
Nick? Question for Mayor Stoney. I know when the phase process began, you wrote to the governor basically asking that we take a step back in RBA. Now with this kind of uptick that we're a little bit seeing here in Richmond, could we see another potential letter to the governor just kind of saying the same thing, just, hey, maybe we should take a step back?
Yeah, the question was, with the data we're seeing currently, seeing a little spike, is there potential for us to communicate with the governor about taking a step back? The virus will always dictate our direction, whether we're moving up in phases or whether or not we move back in phases. And I will not hesitate if, in consultation with the state and also with Dr. Avula, that the data shows that we are seeing a tremendous spike that causes some concern. We will do what's necessary to put public health first. And everyone should know that this administration is willing to do what's necessary to protect every resident, but particularly the most vulnerable in this very critical time. The way we can avoid all that is by wearing these, washing your hands, keeping a distance, and staying out of mass gatherings. This can be a lifesaver right here. And if everyone adheres to the guidelines, particularly the face coverings, I think you can expect those numbers to change over time. I think everybody here in Richmond's been doing a pretty good job. Can we be better? Certainly we can be better. We can see more people wearing masks, face coverings inside closed spaces, and I think that's necessary to avoid us going backwards on this. Like I said, the biggest team project we've ever participated in our entire lives, and we need everyone to do their part.
Quick follow-up to that, just Dr. Avula mentioned that they've been getting a few complaints here and there about some places that have seen a little bit of no mask wearing, things like that. He mentioned they might pull some licenses. Could we see some maybe closing down of places as well if they don't continue to follow? That's for Dr. Avula.
Yeah, Dr. Avula.
Yeah, the question was, as we increase enforcement around mask wearing and our enforcement step is to pull a permit, could we actually see closing down of places? And, our enforcement ability is really to pull the permit, whether that's a restaurant and their, food permit or an operating permit from a business. So, I think we would not take the next step to close them down. We would define a certain amount of time before which they could, re-engage in business. I guess if there were repeat offenders and we had multiple instances, that could be possible. But, these are a lot of the details that are still being worked out at the state level and that our folks in the local health departments will start to enforce moving forward.
Rachel?
The question was in regards to the events that occurred last night, 27 homicides in the city, and also we're still experiencing gun violence as well. What is the plan to address that? Obviously, the two major players involved in something like this, which we've experienced over the course of my tenure as mayor, we need the community and we need the police department to work hand in hand to ensure that those who commit these crimes are brought to justice, and that's exactly what we need at this moment. Obviously, it's very, very difficult now because we are in such a time of uncertainty about programming for our kids, particularly when I talk about our young people, with schools not being open, with the lack of programming in some cases. We have to be even more innovative on how we engage our young people, but just the population in general during these difficult times where public health is at risk. But what's even higher risk to some of our residents is truly gun violence, right? We've talked about this for on a number of occasions since I became mayor, and we are starting to get to sort of laws on the books that prevent the trafficking of illegal weapons and just the inundation of weapons into some of our most vulnerable communities. However, most of these laws were just enacted come July 1. We have to go even further, I think, as not only as a community, but also as a state to prevent these weapons getting in the hands of the wrong people.
Last question, Mark.
Mr. Mayor, last month you called for a criminal investigation into the actions of a Richmond police officer who drove his SUV into a crowd of protesters on Monument Avenue. And then days later, you told a group of police officers that you did not see anything criminal, or you saw nothing criminal. Can you explain that apparent contradiction?
Sure. The question was about the incident that occurred on Monument Avenue in terms of the use of a vehicle by a police officer. Yes, I did call for, I thought what I saw merited an investigation by the Commonwealth's attorney and administrative leave for the officer. The footage I saw, as I stated then, was no criminality. However, I recognize that it is the Commonwealth's attorney's role to determine what is criminal.
Do you frequently say one thing publicly and then a different thing behind closed doors, depending on who you're willing for?
No.
Thanks very much, everybody.
Thank you, guys. Be safe. Stay strong.